Good evening, everyone. My name is Toby, and I'm honored to present the foundational stage of my research titled Foster Care System Reform, Evaluating Policies to Improve Outcomes for Youth Aging Out. This presentation serves as the introductory framework for a broader academic inquiry into how state-level foster care policy implementation affects the lives of youth transitioning out of the system. My research is motivated by a critical policy issue. Despite various federal and state-level initiatives, thousands of young adults age out of the foster care each year without the stable support structures necessary to strive. Let me begin by highlighting the scope of the problem. Each year, over 23,000 youth exit out of the foster care system upon reaching legal adulthood. These individuals often lack stable housing, employment opportunities, educational credentials, and access to health and mental care services. According to the National Youth Institute, up to 20% become homeless shortly after aging out, and nearly half remain unemployed by age 24. Educationally, they lag behind significantly. Less than 3% complete a college degree, and these statistics reflect systematic gaps in how we transition vulnerable youth to independence. To understand policy landscape, I reviewed a range of peer-reviewed literature addressing foster care reform with a focus on transition programs, state policies, and service outcomes. Across these works, four common themes constantly emerged. The first is housing stability and homelessness prevention. The most urgent issue reported in the literature is housing. Studies show that up to half of former foster youth experience homelessness within their first year out of care. And transitional housing programs exist, but vary significantly state by state and are often inaccessible and underfunding. The second is educational access and achievement gaps. While many youth earn a high school diploma, far fewer have access to higher educational due to structural barriers such as school mobility, lack of guidance counseling, and financial insecurity contribute to the vast educational gap between foster and non-foster peers. The third is employment readiness and economic self-sufficiency. Former foster youth are often underprepared for the workforce, and the literature highlights how the absence of job training, career counseling, and mentorship networks negatively affects employment outcomes. By the age of 24, only 40% are employed, compared to 60% of non-foster peers. The fourth is mental health and emotional well-being. Many foster youth report symptoms of anxiety, PTSD, and depression. Despite this, access to mental health services is sporadic, and especially after they lose Medicaid eligibility upon exiting care. A prevailing assumption across the literature is that the foster care system is ill-equipped to support successful transitions to adulthood. Many studies frame the issue as one of policy inadequacy, where interventions exist but are inconsistently applied. Methodologically, the literature is largely quantitative and evaluative, often using state policy comparison, survey data, and outcome tracking. Several key studies, especially those by Dworsky, Courtney, have established benchmarks for measuring program effectiveness. For example, their evaluation of the Extended Foster Care EFC program suggests positive outcomes when youth are allowed to stay in care past the age of 18. However, these studies tend to emphasize short-term metrics, such as immediate housing or employment status, while offering limited insight into long-term outcomes. There are several reoccurring limitations and are as follows. The first is lack of longitudinal follow-up. Most research tracks outcomes only through early adulthood between ages 21 through 24, with little data on long-term stability or upward mobility. The second is neglect of racial and regional disparities. Outcomes for Black, Indigenous, and other marginalized youth are often much worse, yet few studies analyze these differences comprehensively. The third is state-level variation. Many studies fail to adequately compare policy differences across state, which makes it difficult to generalize or identify best practices. Lastly, youth perspectives are underrepresented. Very few evaluations include the voices of foster youth themselves in policy assessments. Additionally, the role of mentorship and social capital, the networks and relationships that provide emotional support and career support, remains an unexplored dimension, despite evidence that these factors significantly impact success post-foster care. Some states offer instructive comparisons. For example, in California, AB 12 extends care to the age of 21 with positive effects on graduation rates and reduced homelessness. However, access to services remain inequitable because in lower income areas. For example, New York City's Housing First model prioritizes housing before other supports, yielding mental health improvements that still lacks workforce integration. States like Texas, Oklahoma, and Louisiana have implemented extended foster care and support programs, but face challenges with rural access, housing shortages, and fragmented service delivery. Based on these findings, the following research question was developed to address the most pressing gap. How do state-level differences in extended foster care EFC policies affect long-term housing stability and economic self-sufficiency for youth aging out of foster care? This question is grounded in the need to move beyond surface-level metrics and explore how specific policy designs shape youth trajectories over time. By identifying best practices and examining implementation differences, we can form more equitable and effective policy reform at both state and federal levels. The implications of this work are both academic and practical. To support foster youth in their journey to adulthood, we need national guidelines to ensure uniform access to services, targeted funding to support housing and mental health access, broader integration of mentoring and trauma-informed care, longitudinal studies that measure outcomes over 5 to 10 years, and inclusion of youth voices in all stages of program design and evaluation. In closing, I believe the literature offers a valuable foundation, but significant gaps remain. My research aims to build upon this by investigating how different state policies influence the real-world outcome of former foster youth, and to advocate for evidence-based, compassionate policy reform. Thank you for your time, and I welcome your questions and feedback. Have a blessed evening.